Medical careers destroy doctors' health. I remember when I was in my first, second years of med school, I was struggling a little bit. And so I was reaching out to my academic advisor, and she was a psychiatrist. And so I was telling her about some of the struggles I was having. And so we started doing some time audits. And so at that time, I was doing really getting into fitness, like I was trying to bulk. And so I was working out 5, 6 times a week, eating calorie surplus. So spending a lot of time associated with fitness. And she was like, hey, maybe you should consider not working out as much, not exercising as much. And I remember thinking in my head that no, like, I don't care if my grades slip away, like, I'm not going to sacrifice my workouts. And then fast forward to third year, and yeah, I was doing rotations like internal medicine, surgery, OB-GYN, and my workouts suffered. I only worked out maybe 1 to 2 times a week in a lot of those rotations, or like at super off times. I remember like some rotations, let's say it was medicine, I'd be so grateful that, let's say, the residents let us out at 2 p.m. instead of the normal 6 p.m. because I'm like, okay, yes, thank God I can go to the gym and actually get a workout in. I experienced similar in residency as well too, where I remember like very vividly during my consultation liaison rotation that so I started working out early in the morning. I was also trying to bulk then. So I would wake up at 5, go to the gym, and then be ready for consult liaison rotation starting at 8 p.m. or 8 a.m. and then do that up till 4 or 5 p.m. And then I'd go home, eat dinner, maybe watch a little bit of TV. And then pretty soon it was like 9 o'clock and it was time for me to go to bed again. And this was rinse and repeat 5 days. And so at that time, I felt like, okay, wow, I don't have anything else to do. My life is just literally gym and work for the whole weekday. Now I'm an attending. I do social media full time. And today's a Monday afternoon. I woke up around 8:30ish, 9. I went to my boxing workout, but then I came home and started recording videos. I work out, I do boxing twice a week. I work out in the gym twice a week. And when I'm at the gym, it's like a 4 hour thing from getting there to spending time in the gym to hanging out in the sauna, showering, all of that. And the best part is that I don't feel rushed at all. I hate when I was in residency, for example, sometimes I would do in between like workouts, like patient workouts, in between patient workouts. So like outpatient, right? Let's say I had a patient at 12:30 and then my next patient's at 3. So I'd finish my 12:30 patient, then at 1 p.m. I would drive to the gym and then get my workout in and then be back in time for 3 p.m. for my next patient. Or I remember like I had another rotation where like in the morning I was at one spot, then in the afternoon we had to drive to another spot and they gave us like a little lunch break in between and travel break. So during that travel lunch break, that's I would go to the gym. And because like I had to find ways to fit it into my schedule. But like those workouts were never that great because I was always trying to optimize for time and get them done efficiently. And it's quite a shame because I this is my story and I've prioritized the fitness and that's why I was able to get it in, but even I felt it struggling. So imagine someone else who doesn't prioritize fitness nearly as much. Then like their workouts are just completely cooked. Their exercise, their fitness gets completely cooked. Like I've seen classmates gain weight in med school. They get stressed in med school, residency. They eat unhealthy. They might do binge eating, right? Like how many of you I'm sure that you've probably seen either yourself or colleagues where you start eating the food you might eat starts getting crappier. You're not taking care of your sleep as much. You're not exercising as much. So these medical careers, they completely destroy our health. And what social media has done for me is that now it's been able to give me my health back. Even when I was an outpatient attending, working at a private practice, I would get into the gym or get into work at 10 a.m., come back at 6. So, like a standard work day. But I was in New York, so commuting to the workplace and then commuting back from work. Then I would go to the gym and then shower and all that. And by that time, it was like 9 o'clock ish, and it was time getting ready for bed. So it's like I've felt like most of my life I've just had work and then fitness, and that's it. And now I feel like with the social media doctor lifestyle, like I have everything now where my diet is on point. This is the healthiest I think I've ever been. My diet is very clean. I can eat whatever I want to. I can afford the highest quality foods and just eating clean, sleeping 8+ hours a night, sleeping 8, 9, 10 hours a night, feeling completely refreshed, waking up in the morning and enjoying the morning coffee, not feeling rushed, working out whenever I want to, as long as I want to, without any care or stress in the world. And yeah, I just feel like I'm the leanest I've ever been. I feel like the strongest that I've ever been, and I'm 32. I feel better now than I did a decade earlier at 22. And all of that is just because of social media, the physician entrepreneur lifestyle. And so I make these videos is because I want to I want to help other physicians achieve the same lifestyle too. Like I'm not making any money off of this. This is time that I'm spending to do it. I just feel called in my soul that we got to know this stuff. We're getting taken advantage of. This career does not have the respect that it used to. The pay has not gone up comparison to inflation. Private equity is taking over. Employers are expecting more work out of us, not less. They're cramming more patients onto us, more administrative responsibilities. Like my sister, she's a podiatry resident. She literally told me that, so she's a third year, so she's going to be leaving in a couple months. And oh yeah, now because the attendings know that we're leaving, they're stacking on additional research projects for her and the residents to do, the third year residents to do before they graduate from the residency. And I'm just like, oh, they're just literally just trying to exploit your labor. And she's like, yeah, I know. But now this is time that my sister has to take out from her own personal life. She's in a surgical residency, so already very time limited. And now she has less time to sleep, less time to eat healthy and cook, less time to go exercise. And so her health is struggling. And so obviously now multiply this by other residents, other surgeons, other doctors in general. And it's literally medicine is taking away our health. My dad recently just had a surgery, and he said that the surgeon was there at 7 a.m., obviously to do the surgery, so he must have been there earlier. And the surgeon saw him before he left the hospital at 8 p.m. that day. And this was like a normal Wednesday. So now multiply that times 5, 6, however many days the surgeon works. And it's like, when does he have time to take care of his health, his sleep, his diet? When does he have time to see his family? He probably doesn't, right? There's that old joke. How do you hide a $100 bill from a neurosurgeon? Tape it to their kid's forehead. It's because this medicine, it just consumes us. It consumes our career. And like you have to be, if you don't want it to do that, you have to be very meticulous in not letting it consume our lives as well, too. And just the way that I found a way to live like medicine, still use it to help patients, still use it in a beneficial context. It's not like I'm just throwing it away like other people who say when they left medicine, they just move on to something else. So I'm still a doctor and I still learn medicine every single day and I still teach. I'm an educator and I still practice. But I do just in a way that really helps me live the most optimal life possible for myself. I get to spend more time with my family than I'm spending more time with my family now than I've ever spent over these last 12 years in this academic pipeline, right? College, med school, residency, fellowship, all of that. Because ultimately, this is what life is about, right? Health, wealth, happiness. Financially, we're doing well. Health wise, I'm the best I've ever been. And happiness, I feel some of the best that I've ever felt. And I just grateful for the fact that I've been able to achieve this. And so that's why I'm really like, I just want to help other people realize that this is an option as well, too. A lot of people, if you think about social media, you know what, I don't want to do it. That seems stupid or it's unprofessional or doctors shouldn't be doing this or that's not me. And I love going into work, clocking in, clocking out. I'm happy. That's awesome. Kudos to you, right? Like you live your life. But for the people who feel like me, like who felt trapped in the system, felt like I was giving my soul, my essence away to the system that doesn't care, that just wants to use my labor and spit me out when I'm done, then the way that I found to break out of that has been through social media. So hopefully this resonates with you. Yeah, definitely check out other videos on this channel. if you really enjoyed this one. And yeah, I'll see you there.